Hello and welcome to the Pharmacy Informatics Professor 2020 with your host, Dr. Armin Simonian. Our focus today is on automation and technologies applied to the medication use process. What I'd like to do today is kind of take a little tour through the med use process and talk about some of the automation that we already have in place. And as we go through these, you'll see the types of projects that you might be involved with if you are a pharmacy informaticist. And at any level, these are the types of technologies that you'll be working with as a pharmacist, whether you're working inpatient or outpatient. So let's start with the presentation. And I'm going to do this today with very few words on the screen and mostly all pictures. And we'll start with talking about the different technologies. And what I'm going to try to do is not get into any specific vendors, but I will show products on the screen. You might see vendor names, and what I tried to do was pick the products in each category that are kind of the top sellers or the pioneers in that area of automation. Here we start with inventory. So as you receive your medications in the pharmacy, traditionally in inpatient and outpatient pharmacies will place those drugs on the shelf, and then what we can do is scan bottles using NDC codes that are on our prescription bottles, or a lot of times our distributors will have our shelves tagged with shelf tags that have a barcode that can be used for ordering and tracking of those medications. To save space and efficiency and include barcode scanning and automation to help us control our inventory, we have something called a carousel, which is rolling shelves. And drugs can be placed within a particular location, a box within the shelves, and then scanned in and scanned out for dispensing. And then we have here on the right-hand side a box picker technology. So this is where there's a robotic arm. It's a storage system, and the user is on the outside of this, just places meds at the window. The robot will pick a location or remember that location for that medication, again, using scanning technologies barcode. Moving on with inventory, we have specialized machines that we used for keeping track of narcotics and other controlled substances. And so here we have two examples of a controlled substance cabinet. So controlled substances that are brought into the pharmacy are checked in and signed off on and put into the cabinet, and then doses are dispensed for individual patients or to be loaded into automated dispensing cabinets and tracked. These machines can also listen for loading transactions at the automated dispensing cabinets and dispensing from those cabinets, and so it can actually track doses of controlled substances all the way to dispensing for administration to the patient. Here we have unit dose machines. So these are machines that can unit dose our medications for us for dispensing to patients. And then I have examples of IV preparation, some semi-automated and some fully automated. So in the middle we have a couple of machines, automation that are used for IV workflow management. And so these will help us with barcode scanning, images, taking pictures of syringes or bags as they're being prepared under the hood, and also gravimetrics, so we can weigh ingredients based on the specific gravity of the ingredient. We can make sure that we have the right drugs in the right amounts in our preparations. So different ways to check that we're making our IVs correctly. On the right-hand side top, we have a compounding machines that's used for total parenteral nutrition or total nutritional admixtures for NICU patients. And this is a compounding machine where you can put in a formula for a TPN or a TNA, and it has the dextrose and water and amino acids. Lipids can be hung also, and then you have your micronutrients, you have your electrolytes, and all of these, again, through gravimetrics can be weighed and added to the solution. And then at the bottom right, we have an IV preparation robot that's fully automated. And so ingredients are loaded into the back of the robot, and the order comes across, and then the robot in this sterile environment can actually prepare the IV solution and dispense it as a fully prepared bag that can be sent up to the floor. We do a lot of trays in the hospital for emergency carts, for code blue carts, surgery trays, delivery for OB/GYN. And so we do have technologies that are used to build, load, make sure that the right drugs are in the right spot on these trays. And then as the trays are used and returned, we can scan for missing medications, replenish those, and bill for those. Probably the most popular technology, the one that kind of revolutionized dispensing in the inpatient setting, is the automated dispensing cabinet. And here's two examples of that technology. And this basically transformed us from going to the unit dose cart system to having the 300 or so most popular medications for that nursing area loaded into the machine, and then the machine through technology can control which medications are available to be given to the patient. So if the patient has a valid order for a medication that's loaded in the machine, the nurse can sign in, pick the patient, pick the drug, and the drawer pops, and that dispensing can be recorded. In the outpatient setting, we have robotics that can actually fill prescriptions fully. Prescriptions are loaded into cells, and the prescription is entered into the computer system, and the system will pick, count, put into a vial, label the vial, and on a conveyor belt show the finished product to the pharmacist for checking, and then that can be dispensed. We also have kiosks that can be used for dispensing medications once they're ready, and these kiosks can also have capabilities for a telephone or video chat. So if the patient needs counseling and the prescription is being picked up after hours or touchless in today's environment, then we can use one of these kiosks for dispensing. We have robots that are actually kinetic, that can pick up and deliver medications to nursing stations. So if you have a inpatient environment that's kind of spread out, and a lot of medications need to be sent to different areas of the hospital, these can be taking the place of a runner, and medications can be loaded and sent to different floors within the hospital. Going to administration along the medication use process, we see here a couple of what we call smart IV infusion pumps, or smart pumps. And these are used to make sure that the right medication, IV medication, is being administered to the right patient at the right rate. And then finally, on the administration side, I wanted to talk about BCMA, or barcode medication administration. And I have a lot of information here about NDC numbers, which are usually what are used for the barcode. And we want to make sure that any medication that ends up in the hand of the nurse to be scanned and given to the patient has a valid barcode that identifies the medication correctly. And that's really the main trick to making sure that BCMA works. But it's something that's really important. We know that a lot of medication errors can occur at the point of administration. And with prescribing, transcription, and dispensing, we have the pharmacist or the technician or the nurse checking the prescriber or the dispenser to make sure that the right medication has been dispensed for the right patient. But at the bedside, when the nurse is administering the medication, there really isn't a safety net. So BCMA provides that safety net for administration of medications at the bedside. And that's it, a quick tour of some of the automation technologies that are out there, and hopefully this was helpful for you to give you an idea of the types of machines that we're using now, maybe spark some interest in looking at some gaps and where you might fill in with some new machines or applications. And if you are going to be starting your job as a pharmacy intern or a pharmacist, I know that you will be exposed to some or all of these types of technologies. And as a pharmacy informaticist, you'll be in charge of the projects where you implement these systems, maintain them, and make sure that they're working properly and serving the pharmacy department as we provide medication therapy to our patients. So if this was helpful for you, please like the video and subscribe to my channel, and I'll thank you for that. In the meantime, stay safe, stay healthy, look after the health of others, and I'll continue working on some episodes for the channel, and hope to see you next time. Take care.